Hello, everyone. Good day. My name is Dr. Onye from Abuja, and I basically want to put out a message there regarding a little analysis I was able to do on two of my, will I say, patients stroke friends that called me to talk to me about the issues that are bothering them right now. First of all, this is no fake news. I don't want you to ever think I will pick my phone to decide to spread any news that is fake or that you feel is not confirmed. This may be confirmed or may not have been confirmed, but this is my analysis as a doctor. So anybody hearing this, please don't think it's fake news. Whoever is going to debunk it is their business. I'm basically concerned for the future of this country, and I have a right to speak on what I think is the problem. Now, coronavirus, whether you believe it or not, it has been in Nigeria since December last year. Why do I say this? Now, I have two people that have called me and asked me questions about what I think about this lockdown. And I told them, I explained from the medical perspective why they need to lock down. And he told me, okay, doctor, I traveled to US in December, came back in January, and I came back. This guy I'm talking to you about, he's a very fit guy, very, very fit. In fact, he doesn't even go to hospitals. He doesn't visit hospitals at all for any reason. He's on point fit, like optimum. And then he came back and then he was sick. He felt sick, and they were saying malaria, malaria. I was like, malaria? He just came in from the US. Where would he contract malaria from the US? And he doesn't like sleep where they have mosquitoes and stuff. So at the time he went to hospital, they did malaria tests. They weren't seeing anything, but they were treating him for malaria. And he had all these florid symptoms of coronavirus, right? He wasn't admitted, but he took the drugs. The thing lasted for these 2 weeks we're talking about. It lasted for that period of time, and then after some time, the symptoms subsided. At that time, there was nothing like corona in Nigeria, so he didn't think it was that. Another person also traveled to Lebanon. The first person I told you about traveled to US, not China, US. So he contracted it from the US, most likely, because he strongly suspects that it was coronavirus. Now, the second person traveled to Lebanon on a business trip in December and came back. Came back with symptoms of malaria and was wondering what was going on. He treated. The symptoms were still there: fever, headache, sore throat, all of that. And so at some point, it was really worrying to him. But after like 2-3 weeks of treatment, it subsided. Symptoms cleared. These two guys are otherwise very healthy people, and they are not old. Now, the guy calls and says, that's one of his factory workers. I'm talking of the guy in Lokoja. One of his factory workers tested positive for COVID-19. And we're like, oh, Lokoja. Okay, did he travel? Did he meet? He said that the worst part is that he hasn't traveled, he hasn't left Lokoja for the past 5 years. That now that he has thought back, especially now that this whole corona thing is in Nigeria, that he feels that he's the one that gave his colleague this virus. And the guy is an elderly, so his symptoms are worse. So he thinks that he's the one that gave him this virus, and that he's now manifesting symptoms. And his symptoms are way worse because he's an elderly person. That is like those symptoms he had at that time was coronavirus. Now, I'm not just using these two people to judge, but I also related it back to the issue happening right now in the West. I'm talking of Italy, US, and all that. This season, or this period where this corona really hit them, was their flu season. If anybody has traveled to the US or UK, their flu alone can kill you. Talking of normal flu, I've been there. I've been privileged to be there, whether I call it a privilege or whatever. But I've been to these countries and I've had flu in this country, and it's almost as if you're going to die. Their flu is out of this world. Normal flu. Now, coronavirus itself has a predilection, an affinity for the respiratory tract. When it sees that your respiratory tract is weak, it goes there and now decides to function, builds an environment for itself. Flu season already, whether you're a fit person or you're not a fit person, your lungs are already compromised, and then you become immunocompromised. Your immunity drops, and then that is when this virus now attacks, and that is what is happening in the US, in the UK. They have survivors quite all right, and surviving it may be based on your immune system or whatever, but there are also a lot of deaths. And if you check it, most of them have some respiratory problem, especially during this flu season in those parts of the world. Now, if you've been studying this disease from the beginning, you realize that towards the summer is fast approaching in these parts of the world. Towards the summer, you will see that the curve will start flattening, and the deaths will start reducing. Their cases will also start reducing. Just watch and see what I'm going, and just monitor all this I'm telling you. Their symptoms are going to, the people that will basically be having problems are those that they were already, diagnosed prior to that period. But during the summer, because that is when the flu season will be over, their symptoms will begin to reduce, cases will begin to reduce, deaths will begin to reduce. But on the other hand, in Nigeria, our rainy season is basically our flu season. Our rainy season is fast approaching. This is the virus attacked them during their flu season. Their flu season is going to be over very soon. These are countries that have almost everything for, I'm talking of hospitals, vets, even if they are really having lack of it now because of the situation. It's become overwhelming. They will get through it, I know, but there may be a lot of deaths. But our own flu season is coming very soon. Rain has started falling in a couple of places, and a lot of people already have allergies. I'm talking of respiratory allergies, rhinitis, rhinosinusitis, all of those kind of diseases. Now, and this is a virus that has already come into Nigeria, whether you like it or not, because a lot of people travel during Christmas, before Christmas. A lot of my Igbo brothers, a lot of my friends, people traveled to the US, to different countries for Christmas holiday. They came back with this virus, and they did not know that was what they were suffering, because people can actually have this virus in their homes and not know. They just have mild symptoms and it clears. So most of them, if you trace back, that's why we need to really do the contact tracing and do it properly. Let's trace people that traveled from that time. Ask them the symptoms they had, and bet you will see that many of them have had symptoms relating to coronavirus that weren't malaria, or maybe they thought it was malaria. Now, the virus has been here since December. We are imposing a lockdown on Nigerians, which is good, which is okay, because that's what other countries are doing. It's working for them, social distancing and all that stuff. But we really need to sit down and think of what will work for Nigeria, because our flu season, yet again, is coming, like I said. And a lot of people are going to have respiratory problems. A lot of people are going to have respiratory symptoms. A lot of people will sneeze. A lot of people will have respiratory infection. I mean, I'm a doctor, I see these things. So that is going to be the point at which this virus is going to attack. So trust me, as we are leaving this lockdown, we may be thinking we are reducing, but that is when, after this lockdown, that is when we may see the real pandemic in Nigeria. And this is a country that's already suffering from health sector problems already. So whoever is listening, this needs to get to the government. I'm not interested in I don't want anybody to know me. I just want people to know that this is how I feel the virus works. Because I spoke to people abroad too, people that I know abroad, and they said, from the stories they are hearing from doctors and nurses, this is their flu season, and this is why it is this bad. Because they studied the virus and they see that it has affinity for the respiratory tract. So we have to be careful the measures we impose. Let's not do things because other countries are doing it. They are doing it based on their weather at the moment. They are doing it based on their environment. We should focus on our own environment and see what works for us. How do we solve this problem? Maybe at this moment of lockdown, there should be testings going on. There should be they should be going around testing people, right? People that give calls, they should go around testing them. And then proper supply of quality face masks for them to wear. Nobody should leave their houses without face mask. I don't believe this thing that is being said of don't wear face mask if you don't have symptoms. We've all seen how this virus spreads. It can be in the air for a very long time. The small droplets. The large droplets, when somebody sneezes or talks, can fall on the floor because they are heavy. But the tinier molecules, they suspend in the air, and anybody can inhale them at any time. So this flu season that is coming is a problem. We should focus on what can work for our environment. I feel there should be, because this is not a medical problem, in my opinion. It is a social problem. And that's why they said social distancing and all that. It basically means when you come in contact with somebody that has it, you can have it. So anything that will make you socialize, completely stay away from it. But in our environment, they need to provide quality face masks that will actually prevent this thing from spreading. Stay-at-home measures should be, it should be imposed, but they can still maintain their social distancing while at work and all that stuff. I don't know how long. If stay at home is going to work, fine. But I don't know how long it's going to work. If you're really going to impose stay at home, 2 weeks is not going to be enough because the flu season is coming. If you're going to say after 2 weeks, everybody should go back to their normal businesses, trust me, we are digging our graves before we are shooting ourselves in the leg. So anybody who is out there listening, any government official, any person in the COVID-19 task force, or that can relay the message to them, please do that. They need to sit down and do proper thinking. There need to be think tanks that will sit down and think of proper measures to make sure that this thing doesn't go around in our own environment. We are not the US, we are not UK. And our flu season is fast approaching. Their own is going to come down very soon. And you've heard that it's going to take a while for this vaccine to come out. It's going to take close to 18 months, if not more. In as much as I have faith that something good will happen before then, but please, Nigerian people, open your eyes. If you're somebody that has respiratory problems already, best believe it that during the rainy season is going to be a bigger problem for you because you're automatically at risk. Not to talk more of our elderly. Thank you very much for listening, and I hope this message goes to the right hands and they actually listen to this and use it to work on whatever they are working on.